respected esteemed faculty members and everyone. Today I'll be presenting a paper on the topic effects of laser peripheral iridotomy and cataract surgery on anterior chamber angle parameters in primary angle closure suspect patients. Primary angle closure suspect has been found to have a much higher prevalence than that of primary angle closure. The first-line treatment for primary angle closure suspect includes a prophylactic laser peripheral iridotomy, which creates an alternative route for the aqueous to pass from the posterior chamber to the anterior chamber. While in cataract surgery, it helps by eliminating the thick anteriorly positional lens, which is considered to be the primary pathology in primary angle closure suspects. The study is a prospective comparative interventional study conducted in a tertiary care center of Assam from 1st January 2022 to 31st December 2022. Inclusion criteria includes patients diagnosed as primary angle closure suspects, patients with early cataract, that is opacification in the nuclear, cortical, and posterior subcapsular regions graded as 1 or 2. The exclusion criteria includes patients with evidence of a previous acute episode of angle closure, primary angle closure with peripheral anterior synechia, primary angle closure glaucoma, ocular hypertension, corneal abnormalities, and cataract obscuring the posterior segment, and prior intraocular surgery, and patients who were unwilling to enroll in the study. The patients were recommended either laser peripheral iridotomy or cataract surgery depending on their best corrected visual acuity. Patients with better best visual acuity better than 0.3 logMAR value were advised to undergo laser peripheral iridotomy, while best corrected visual acuity worse than 0.2 were advised to undergo cataract surgery. The cataract surgery performed was standard phacoemulsification procedure under topical and peribulbar anesthesia, and foldable posterior chamber intraocular lens were implanted after the procedure. All the participants underwent routine follow-up at day 1, first week, and 4th week after the treatment. Post-op, anterior segment OCT and gonioscopy were conducted at 1 month follow-up. And all patients underwent detailed eye examination, including the visual acuity assessment, IOP measurement using a Goldman applanation tonometry, a slit lamp biomicroscopy, static gonioscopy, optic disc examination with a 90D lens, and anterior segment OCT, where the anterior segment parameters were measured in all cases. These are the angle parameters that were included: angle opening distance, trabecular iris angle, trabecular iris surface area, and the angle recess area. Coming to the results, in total, 39 eyes of 33 patients were enrolled in the laser peripheral iridotomy group, and 37 eyes of 28 patients were included in the cataract surgery group. There were no post-operative complications at the end of the 4th week follow-up. In the cataract surgery group, all quadrants in all of the subjects had open angles after operation, while in patients post-laser peripheral iridotomy, about 12 eyes, that is 30% of patients, still had a residual angle closure in at least 2 quadrants, and 56% of the patients who underwent laser peripheral iridotomy had appositional angle closure in at least 1 quadrant. Here we can see post laser peripheral iridotomy, there is a change in the trabecular iris angle, while in case of cataract surgery, there is a drastic change post-procedure. And all the parameters showed drastic difference in the pre and post anterior chamber angle parameter changes. This is the table showing the comparison of gonioscopy before and after the laser peripheral iridotomy and cataract surgery. Here we can see post-cataract surgery, the Schaffer grading was found to be 4. In our study, the grade of the gonioscopic angle and the AIOC findings were in agreement, indicating that both the interventions were effective in considerably widening the angle. When 2 groups were compared, cataract surgery was found to be superior to laser peripheral iridotomy in opening the anterior chamber. The changes in anterior chamber angle parameters that we observed in our study suggest that the careful management of the patients undergoing laser peripheral iridotomy or cataract surgery is warranted to minimize the risk of complications such as angle closure glaucoma. So we can conclude by saying that our study revealed that performing cataract surgery on patients with PACS was more effective than LPI in widening the anterior chamber angle. While both treatments led to a significant increase in angle width, LPI result in residual angle closure in 30% of eyes, while all patients who received cataract surgery had open angles in all 4 quadrants. This can provide a compelling evidence for future prospective randomized studies on this topic. These are my references. Thank you.
Did you see the lens thickness?
There was no option for finding the lens thickness.
That's one of the most important thing nowadays that we do, where peripheral iridotomy is going to help or a cataract surgery. So try to assess that. The biometry nowadays gives us the optical biometry. You don't have to have an anterior segment OCT also for that.